Prosthetic joint infection case discussion. A 50-year-old female patient presents 6 months after knee replacement surgery with persistent pain and gradual swelling around the joint. She has a history of rheumatoid arthritis and has been on methotrexate therapy. A radiograph shows implant loosening, and joint aspiration reveals a high WBC count with a positive culture for Staphylococcus epidermidis. Possible VIVA questions. What is the most likely cause of this patient's symptoms? The answer is chronic prosthetic joint infection due to biofilm formation. The infection has been present for months, and the pathogen is likely forming a biofilm on the prosthesis, which leads to persistent symptoms and difficulty in treatment. What is the significance of biofilm in prosthetic joint infections? The answer is, biofilm protects bacteria from the host immune response and makes eradication difficult. It also reduces the effectiveness of antibiotics. Biofilm formation is a key factor in chronic infection, making it harder to treat with antibiotics alone. What would be the management strategy for this patient? The answer is, two-stage revision arthroplasty is the gold standard for treating chronic infections. This approach allows for the removal of the infected prosthesis, followed by a period of antibiotic therapy and then reimplantation.